Morning is Abid Malik with vPhysicians, and this is a solution to help home care providers connect with their physicians on the data end of things. So I'll just hand it off and let you get going.
Good morning. It's an honor to present in front of the Kauffman audience. Can somebody guess what the V in vPhysician stands for? Virtual is one of the answers, but the good answer is visiting. So this solution is about physicians who used to visit the patient in their home. They're not doing that anymore, so we thought we'd come up with a solution that will help the physician connect with the nurse practitioners. What vPhysicians does? It does three key things. One is that it focuses more on the business side of the practice, and that could be marketing, management of the practice, and also the financial part of it. The second thing that it does is that it brings the physician closer to the home healthcare staff, and that could be nurses and private duty people. The third thing that it does, it takes away the physician's responsibility away from that doctor and transfers that to the home healthcare staff or nurse practitioners. We have been in e-commerce business since 2004. That business didn't go well. So failure in one market forced us to get into another market. 2 years ago, I met with this physician in Chicago. He wanted to make his practice paperless. I thought this was a good opportunity, so we worked together in a way that he ended up getting additional patients, and my company ended up with the technology. We have been doing the development since 2011, so we have passed that development stage. We are in a phase in which we're looking for the funding. So why we need the vPhysician, the need assessment. Number one is that patients, especially the patients who are, let's say, around 80 years of age, they don't want to go to hospital. They also don't want to go to the nursing home. So this is one of the pressing needs. The other thing is that if you know the patients who end up in the emergency room, the cost is exponential. So the goal is how you provide the tools to the physician and the hospitals in this case to keep the patient home. Because if you do the 10 visit at the patient's home, that offsets the cost for a day in a hospital emergency room. The third thing is that it brings the efficiency in the practice. There was a recent report that was issued by Medscape. The idea was that 10 to 20 hours a week, this is what the physician spent on the paperwork and the administrative task. So if you can take away those administrative and paperwork tasks away from the physician and pass it on to the medical assistant, that will be great. And also, as I mentioned, in 1960 or during the 60s, 40% of the physicians, they were visiting home, and that number is down to 1%. So there is a disconnect between the physician and what's happening to the elderly patient in their home. This is the market size. We got a lot of elderly patients who are in that category, and their number is increasing, it's not decreasing, for two reasons. Number one, the medications and the technology in the medical is keeping people alive for a longer period of time. And number two, the baby boomers. The Medicare expense is about $558,000. This is what the government spent in the last couple of years. This is where we are, about $558 billion. Out of that, the patients who are in the long-term care, we estimated about $65 billion. This is what the Medicare or the government is spending in that area. Now, where we are, we know that there are a lot of EMR applications, about 373. I mean, it depends on how you count it, but this is where we are. In the home health industry, we have about 92 home health care applications. So what we're doing is, in order to bring the physician and the nurse practitioner together, we have to come up with a solution that works for both, for physician and also for the home health staff. Now, these are the screenshots that I'm going to share that with you. Number one key feature is that the clinic website and the back end, which has the EMR and practice management application, we have fused them together. On the front end is the website, and on the back end is the medical practice management application. The web pages are search engine optimized, so we didn't have to pay to anybody to come up with this ranking on the Google there. So if you type, for example, this keyword, and there are other keywords that you could use, and we will still come on the top. And that was all free. This is basically the dashboard. When you log into the back end, this is what you see. As you can see, there is a patient appointment exam. And also we have a project and task manager to manage the practice better. And this is very robust. I don't have a time to go through it. And then the document, like x-rays. If some of the nurses, they cannot write into the EMR application, they can always scan the exam and they can upload it. So this is the area you could find those paperwork, and also the billing portion. The number one need of a practice is the billing, because this is where they lose a lot of money. As you know, the engineers and the physician, they are good in what they do, the technical part, but they are very weak in the financial and the marketing and the other areas. This is the patient chart. Now, one of the features that we also have is that we can take the patient data, whether they are the current patient or the future patient, we can project that on the Google map, and then we can see if these are the current patients or the potential patients. This is the CRM portion of it, where we can keep good relationship with the patient and acquire the new ones. Because it's a web-based application, it's tablet compatible. What that means is you can take the tablet, you can pretty much work with it. This is my contact information, and I'd be glad to answer any of the questions that you may have.